What this does is it allows the patients for the first time to be able to look at the kind of care to expect, be able to compare it with what they've got, and then perhaps to come back to the clinician and say, I know I've got this, but do you think I should have that instead? That's a great discussion to have.
The visual nature of it means that you know, picture paints 1,000 words, doesn't it? And so the map of medicine's picture paints 1,000 words of description around what's going to happen to you as you go through a pathway.
I'd love to see patients use it. In this patient-centred NHS, how powerful to have these the maps in patients' hands who can say, well, this is the pathway I should be following. Why aren't I following that journey? You know, what's going to happen to me? Because people like to be in control of their lives. Information gives them that control, and I think the map will actually enable them to stop getting lost in the system and plan their route. And it's interesting, when you go on a car journey, you actually get a map out and plan your route, and yet we expect people to come to give their bodies to the NHS, and they never know when the journey starts or when it ends or which point what will happen, and that clearly shouldn't be right. So the map would actually assist in that knowledge for patients who actually can take real control.
What the map does is uniquely, it's a tool that allows decisions made at different levels in relation to change processes and reform processes, encompasses it into one single unit by having a very flexible tool, which is what the map is, and bringing it directly to the clinician's desktop.
I think the most important issue is communication, because for years and years our GP colleagues do not exactly know what we want from them before referring a patient. That is a very important understanding of the communication process that Map of Medicine has initiated.
It's just informing me. It's suddenly making me realise about information I didn't know, doctors' educational needs, or even the patient's unmet needs. You know, I didn't know that actually if you've had 5 episodes of tonsillitis in the last year that you ought to be referred. It was the map that gave me that. It wasn't my trainer, it wasn't all the magazines I was reading, it wasn't the journals, it wasn't the training sessions I have, it wasn't me sitting in my training sessions with all my other colleagues. It was the map that gave me that.
One of the key areas where the map would offer support would be, say, in the out-of-hours service, where you have a triage nurse. Yes. Currently they use local pathways or the pathways that they've acquired through a particular company, but the map would bring uniformity of what it is that the person needs to be asking and what it is they need to be doing. And it also offers them a certain element of cover for the roles, for the tasks that they're performing when they're on call. So no, the map is going to be very useful for allied health professionals, and that goes across the boundaries, you know, for pharmacists, for optometrists, and for all of the nursing profession.
Map of Medicine starts life as an educational resource, as an academic tool, as a place of interest for maybe nurses that are learning, for junior doctors, or maybe for consultants even who aren't particularly familiar with a particular area. They can go in, they can look at one of the 380 or so pathways, they can find information behind those pathways, maybe look at some explicit informations and get some options.
For me, it will enable nurses to practice with confidence that they are following the same journey as medical colleagues and allied health professionals. So we have a consistent way forward in dealing with that patient and the care of that patient, which again gives the patient confidence that everybody's talking of the same language. So what it does do, it enhances our professional practice, and most importantly the multidisciplinary working, which is key and is so dependent in healthcare.
I think it's invaluable with regards to service improvement. As I said, it's a real good starting tool. We can see we've got some sort of drafts of where we are now and where we need to be. So I find it a very useful tool. It's also a really good visual tool, and it gets clinicians involved in the process.
Right from the chief executive level to our business manager, they are very interested to find out how this is progressing, because it will in the long term help in creating a bridge between the two.
Within newborn hearing screening, we've got a large number of professionals, maybe 15 or 16 that I often talk about, but there's many others as well. So it's important that they all have a view of what's happening and that we eventually come to a place where each of those individuals can help the family and child without having to get them to repeat their story, without going through large amount of old information, so they can bring their specialist skills to bear as rapidly as possible. And I think the map will enable us to do that.
For me, it's about evidence and providing good practice. So we've got the library staff involved, and we can use the National Service Frameworks, any good practice guides or evidence and research that's out there at the moment, and make sure we bring that into the pathway and make sure that what we're changing, we can't just change pathways willy-nilly, we need to make sure that they're following good practice. And the map of medicine just gives you the structure to do that. Well, I think from a commissioning perspective, the useful part of it is we can look at what can we deliver in primary care, what should be coming into secondary care, and we can actually change around the way we deliver our services. And also adding the timelines to the map. That gives us great incentives to move things into different areas and to look at, good example with the carpal tunnel pathway, we've moved nerve conduction into primary care. So although we actually deliver the service in the hospital, they don't come and see the consultant until all the workup's been complete. So using the map of medicine just highlights what needs to be done and how can we deliver it differently.
I would say it helps us to get into the discussion, so that I don't think the map should make the decisions. I think the people who ultimately are responsible for delivering care should be the ones who make the decisions, but the map helps to inform us all.
The clinicians are actually telling us how they want pathways to be run, what is the most appropriate pathways, and we can then attach the pathways onto the contracts and say, you know, these are the things that we do not want you to do, but these are the things we do want you to do. These are the services we want.
So one of the things that's happened with our breast pathway is that it's timed. So cancer, for clinical reasons, as well as operational or quality standard reasons, is a timed pathway. That can be done on all pathways. That can inform clinicians and managers when they're looking at it, and indeed commissioners, as to, well, how long do these things take? And indeed, if you have localisation, maybe between health communities or between organisations, actually commissioners can actually have a look to see whether the time pathway at one place is better than the time pathway at another, or maybe that actually the flow of the pathway in terms of where services are delivered is better for patients in their community than it is perhaps for patients in another community.
What it enables us to do is that we can ensure that there is a cohesive journey for patients. So we will be clear what primary care should be doing, and that's doctors and nurses in primary care. We will be clear what our hospital consultants and nurses will be doing, and we will be clear in the aftercare that people will need for that continuation. So therefore you'd be able to commission each part of the pathway in a joined up way.
The gap between what we know and what we do yawns like the Grand Canyon. Now, knowledge alone does not bridge the Grand Canyon, but having a way in which we can write down in a form that people can understand what it is we want dramatically helps us achieve. If, for example, you ask, what does the NHS want for rheumatoid arthritis? I cannot show you any document other than the map of medicine. We have to write down what we want, and then there's half a chance that people will do it.
From a strategic point of view, I think it delivers the two things that you're looking for. I think it says, right, it manages to capture the evidence that there is and say, these are the sorts of things that have shown to give good patient and family benefits. And these are the sorts of systems that you can use and modify locally to deliver that best practice.
A tool such as a map can actually help steer policy. It could be as powerful as that. Because all of a sudden, here's a toolkit where every clinician is linked to, not just for feeding information to clinicians, but also to get feedback. And that simply makes it a powerful tool. Yes? And that can influence policy.